Good afternoon, everyone. It's really an honor to be here um, introducing this new kind of event that Roche started working now with FIS, the Fórum Inovação Saúde. And we have the honor, and for me especially, because I have been studying what Dr. Mario Plebani has been doing for more than 28 years, and now he's here with us. He's a global reference in laboratory medicine. I had a chance to collaborate with him when I was working in Becton Dickinson in BG. Now I'm working with Roche, and we have the honor to work and collaborate again. So no more words, because I'm also, like you, very excited about his lecture. He prepared something that's very special for Brazil and for Latin America, for all the countries. So Dr. Plebani, welcome. We are very glad to have you here. Welcome.
Good afternoon, Vito, and delighted to be invited to deliver this lecture to my friends in Brazil, one of my favorite countries, and I really hope to visit you in Brazil as soon as possible when the pandemic will be finished. So, the topic of my talk today is about sustainability of the healthcare ecosystem through the laboratory medicine and diagnostic role in the value chain. But let me introduce, first of all, my university, one of the oldest university in the world. We are celebrating, by the way, this year, 800 years from the foundation of my university and medical school. And you can see on the left of the figure, the oldest and first anatomic theater in the world, and the magnificent, on the right side, the magnificent Aula Magna dedicated to Galileo Galilei, who was teaching in Padova University for more than 10 years. What I like to do today is to share with you some ideas about the sustainability in healthcare and the role of clinical labs. What means sustainable clinical laboratory services? Dealing with the concept of value-based laboratory medicine, remembering the seminal concept of the brain-to-brain loop, and dealing with the dimension of quality in laboratory medicine, the topic of quality indicators, some about outcome measures, and integrated diagnostic, to conclude with some take-home messages. What about sustainable clinical laboratory services? This is a definition of sustainability in healthcare. And the concept is that sustainability shifts from an environmental concern towards a better and wider holistic definition that includes balancing socio-ecological and socio-technical systems, including, this is very important, effectiveness and cost efficiency of health services. This means that different aspects of sustainable development create complexity, but they require a multidisciplinary approach, and laboratory medicine clinical labs play a relevant role in this multidisciplinary approach. This is a very interesting, I hope, document of the European Federation of Clinical Chemistry and Laboratory Medicine, in which I was elected as president. You can download the document, and this is a guideline for green and sustainable medical laboratory. So laboratory medicine should contribute or must contribute to a sustainable healthcare system, ensuring that resources can be used in an efficient way, providing high-quality services to both patient and physician. And I like to remind you that laboratory tests are, for sure, key elements for human health and should help clinicians in the clinical decision process, should provide value for primary, secondary prevention, not only for care. And this is my view about how clinical laboratories may make possible a sustainable process. From one side, we have to create a valuable environmental dimension. That means green procurement strategies, affordable services, waste reduction, water and energy conservation. But from the other side, very important, value-based laboratory medicine, increasing the efficiency, but very important, the effectiveness of laboratory service. In one word, the right test at the right time for the right patient with the right analytical results and the right utilization of the laboratory information. Starting from the beginning, clinical laboratories are major contributors to carbon emission and waste, unfortunately. Waste, for instance, non-biological solids, plastics, paper, electronic waste. And this is emphasized in this slide that 15% of healthcare waste is infectious or radioactive or toxic, unfortunately. From the other side, energy consumption, because specialized laboratory instruments, temperature, humidity control, ventilator system need energy consumption. So we have to reduce the environmental impact, and clinical laboratories can limit their environmental impact, making possible in 4 key areas. First, energy consumption. Second, water consumption. Third, waste production. And finally, reducing the use of hazardous chemicals. And this is a concept of sustainable chemistry, or better, green chemistry, reducing toxic substances and allowing safe end-of-life recycling and the reuse of substances. So this is the hierarchy of hazardous chemical waste management, in which you can see that prevention, reduction, recycling, recovery, disposal are very important aspects. So introducing safe and better sustainable chemicals, minimize and control, and eliminate and remediate the use of this type of materials. What can we do to improve efficiency and sustainability? Digitalization. In this way, we can reduce waste and costs. Telelaboratory services may reduce carbon emissions. Middleware algorithms may improve test request appropriateness. And finally, we will see in the last part of my talk, integration of all diagnostic information. We are now moving to the concept of value-based laboratory medicine. What is value in healthcare? We know that care for medical conditions and patient population usually involves multiple specialties and numerous interventions. So the values for the patient is usually created by providers' combined effort over the full cycle of care. And the benefits of any intervention for the final outcomes will depend on the effectiveness of other interventions through the care cycle. And this is a sentence from a paper by Michael Porter published in New England Journal of Medicine some years ago. Unfortunately, healthcare, including laboratory medicine and clinical lab, is fragmented and siloed, involving multiple providers at multiple facilities who may even be in different networks and often do not share information with another one. Fragmentation, particularly in diagnostic, involve laboratory medicine subspecialty, I mean clinical chemistry versus hematology versus coagulation, but also versus microbiology, molecular diagnostics, virology, and anatomic pathology, radiology, and the interaction with the physician. So quality outcomes are attributed to each encounter alone, but should be better recognized that they are the result of a continuum. The system, therefore, should track the patient journey, not just over multiple encounters, but ideally over a person's life course, if possible. So the silo metaphor is an inappropriate description of current practice in diagnostic specialties, including laboratory medicine. The lack of interaction and cooperation with other diagnostic specialties, with clinician and patient, may lead to a dramatic weakness, poor understanding of the value of laboratory tests, over and under utilization, and incorrect interpretation of laboratory data. So, what we should do is breaking down silos in healthcare and in laboratory medicine. This is a picture of the diagnostic process in which the Institute of Medicine will recognize the role of diagnostic testing, laboratory testing, as a fundamental part of the diagnostic process. As you can see, the outcomes to be measured are very important to recognize the value of diagnostic and laboratory information. And therefore, we know that the diagnostic process, including laboratory medicine, is a collaborative activity. Making accurate and timely diagnosis require teamwork. And therefore, the diagnostic process should be viewed as a team-based activity. This is another interesting slide in which you can appreciate the role of pathology and laboratory medicine all together, clinical laboratories and anatomic pathology all together, to provide diagnostic information which make possible better clinical outcomes to the single individual and population. So the concept of team-based care and diagnostic management team model means that we have to create integrated teams to make possible the right request of laboratory tests and the right interpretation of laboratory information and the action upon this type of information. And this is an example, once again, for the document of the Institute of Medicine published in 2017, in which you can see that in the field, for instance, of oncology, it's very important to recognize the role of the cooperation between several professionals, including radiologists, laboratory scientists, medical oncologists, other healthcare professionals, including nurses, of course, psychologists, pharmacists, and so on. So we are moving now from the traditional model, laboratory-centric, operating in a silo, in which the cost per test is very important, with limited care coordination and focus on the analytical phase of the testing cycle. We are moving towards a value-based model, integration with other clinical services, emphasizes the importance of all steps of the testing cycle, coordination of laboratory information with other diagnostic information. And what is very important is that we have to make all laboratory results an actionable clinical and management information. Actionable clinical and management information. This is the goal of everyday practice in laboratory services. Now, laboratory medicine is no more the Cinderella of the health system, because it was recognized that it is an integral part of health system, and I hope not only in high-income countries. So it's very important not only for the care, but for disease prevention, early detection, and therefore pathology and laboratory medicine is even more important part of modern medicine and healthcare. But what is the value of laboratory testing? The value of a laboratory test cannot be ascertained only on the basis of chemical or clinical performance characteristics, but by the impact on patient management, the only true assessment of the quality of testing being finally the quality of patient outcome. In other words, the actionable laboratory information is much more important than the pure analytical performance characteristic. The quality in laboratory medicine has been defined as the assurance that each and every step in the total testing process correctly performed, ensuring valuable decision-making and effective patient care, but allowing better outcomes, both clinical and economical, for individual patient and the community. Cloud quality in laboratory testing include all aspects of the brain-to-brain loop, from the pre-analytical phase, the right test choice at the right time for the right patient, through analytical steps, very important, right results in the right form, to the final post-analytical phase, the right interpretation of laboratory reports at the right time, with the right advice as to what to do next with the result. We are moving now to the seminal concept of the brain-to-brain loop. This is George Lundberg, one of my mentors, who conceived the concept of the brain-to-brain loop in 1981. As you can see, the need for a laboratory testing starts from the physician brain, and after a series of steps: ordering, collection, identification, transportation, preparation, analysis, reporting, interpretation, the physician brain make possible a better action for the patient. We revised this brain-to-brain loop concept some years ago, after 40 years, introducing two other brains. The first one is the laboratory brain, because the lab, the clinical lab, now may control and improve all steps of the testing process. And the patient brain, because the patient today would like to better understand why a laboratory test has been requested, what happens if the test is positive or negative, what should be done thereafter. And what is important is that I believe that analytical quality is still the core business of laboratory professionals, but we have to raise our awareness of the interrelationship and interconnection between the different phases of the testing cycle. And only in this way we can improve the quality of laboratory information. And this is another similar sentence I wrote some years ago. So what counts is the continuum inside the brain-to-brain loop. And therefore, we have to start with the mantra, only good samples make good assays. In the pre-analytical phase, we have to assure good sample quality, and the 5 rights are the right patient, the right time, the right test, the right sample collection and sample handling, and finally, last but not least, the right sample transportation. In the pre-analytical phase inside the lab, within the lab, we have to assure the right specimen quality. And the 5 rights are the right separation, the right pre-treatment, for instance, centrifugation, the right aliquoting, the right sortation, and the right routing. And only if we have good specimen quality with good analytical instrumentation and system and methods, we can achieve good analytical results. In other words, even the best analytical system, if the specimen quality is bad, cannot assure good analytical results. But it's not enough. If we have good analytical quality, good analytical results, in the post-analytical phase, we have to assure good laboratory reports, and the file writes are right turnaround time with the right data validation, right measurement units, right reference range and decision limits, right critical values, and eventually the right interpretative comment. And we have to move in the last part, the post-analytical phase, in which the laboratory information should be assured. And therefore, the fine right are the right acknowledgement by the physician and nurses, the right interpretation, the right utilization for the diagnosis or therapy, the right follow-up, and finally, the right documentation. And only in this way we can improve the clinical and economical outcome. So what is very important is to better understand that the final goal of the brain-to-brain loop, that means the total testing process, is to assure better clinical and economical outcome for individual patient and for the community. We are moving now to the dimension of quality in laboratory medicine. And I like to show you my concept about the two phases of laboratory quality. We have an internal dimension, accuracy and reliability of laboratory results, timeliness and efficiency, low costs. And this makes possible efficiency. But there are another very important dimension, patient-centered, which deal with the diagnostic accuracy of laboratory tests, the value of the test in the test treatment pathways, the effect on patient outcome, and finally on patient safety. And this makes possible effectiveness, that is value of laboratory services, the value of laboratory services. So the internal dimension should be provided by process measures, internal quality control, external quality assurance, and the topic of the model of quality indicators. But to assure effectiveness, we have to measure the outcome. Outcome measures are very important. So in this slide, you can see that we can measure what we are. We can measure only the analytical results. We can measure the quality indicator in the total testing process. And we can measure the clinical and economical outcome. But my view is only in this way we can really demonstrate the value of laboratory medicine and clinical laboratory if we are able to demonstrate the impact on clinical and economical outcome. And therefore, the true question is, we are what we measure. And if we measure only the analytical results, we are faceless executor. The clinician asked to measure 100 tests, and we can do. If we measure the total testing, in the total testing process, the quality indicator, we are process owners. That is much better. But only if we measure the outcome, we believe member of diagnostic team, and we create value and demonstrate the value of laboratory medicine. So in this slide, you can see the different type of measure. Analytical quality indicator, external and internal quality control, easy to be measured, state of the art. Quality indicator in the total testing process, much more difficult, but work is in progress. Outcome measures, which really are able to demonstrate the value of laboratory testing in patient management and clinical pathway, but they requires integration and collaboration at the clinical laboratory interface. But I like to ask you, we would like to perceive the clinical lab as a commodity or an integral part of the diagnostic and therapeutic process. So we cannot focus only on internal indicators of analytical quality and efficiency. We have to move toward indicators of total quality, clinical effectiveness, and patient outcome. And in this way, we are able to demonstrate the value of clinical laboratory. So in my view, we have to put together the different type of measure, analytical, the measure in the total testing, and finally, outcome measure. In this way, we have a holistic approach that is patient-centered. We are moving now to the topic of quality indicator. And this is the website in which you can have all information about this program under the umbrella of the International Federation of Clinical Chemistry and Laboratory Medicine. I'm still the chair of this project, but in Brazil, some friends, particularly my friend Wilson, made a great work, and I know that many clinical laboratories are still participating in the program. We have organized two types of consensus conference in 2013 and 2016 for harmonizing the list of quality indicators. So this is a process of harmonization at an international level, and in particular, we achieved consensus on the list, on the automation of data collection, on the statistical treatment, and the criteria for defining the specification of the quality indicator. And I'd like to remind you that implementing quality indicator is a must for the accreditation according to the unique international standard 15189. This is the requirement. It's clearly written that a laboratory must establish quality indicators to monitor and evaluate performances in the pre, intra-analytical, and post-analytical phases. And this is a list of quality indicators. Do not hesitate to contact me if you have some more information. This is the type of data reporting and the frequency of distribution. By the way, now we would like to make possible a devolution of the program. We would like to translate from English in other languages, particularly in Portuguese and Spanish, and to have leaders, champions in every country to make possible the discussion of the results and the management of the result in each region and country. So do not hesitate once again to contact me. I will move now to the topic of outcome-based approach. Which type of outcome? In the laboratory, appropriate test utilization, reduce laboratory cost, increase productivity, better turnaround time, improve total quality. But if we are looking at in the clinical and overall field, reduce antibiotic use, for example, introducing laboratory stewardship and eventually procalcitonin measure. Decrease length of stay in the hospital. Decrease mortality and morbidity. Decrease readmission in the hospital. And reduction of the cost for the healthcare system. All these are outcome measurements. And we have some example in laboratory medicine. This is an example for cardiac troponin, in which you can see that all subjects with the values lower than 5 nanograms per liter not only do not present myocardial infarcts in the same day, but even at 30 days, no death about myocardial infarction has been documented. Very impressive results. For BMP, brain natriuretic peptide, but it's the same for NT-proBNP. This is the survival events related to the value of natriuretic peptide. This is for NT-proBNP, particularly in amyloidosis. You can see the difference in survival proportion of the subject. And this is another data about the economic outcome in which the glycemic control was improved, having as a target glycated hemoglobin. Very impressive results. And you can see this is the reduction of number of complications and the reduction of the costs for the healthcare system thanks to the measurement of glycated hemoglobin. And this is the cost per person in Australia, for example. Very impressive results. But this is another interesting data about the value of androgenetic factor in preeclampsia, in which you can see the difference of the values. But what is very impressive is after introducing this type of measurement, which is costly, there is a reduction of the total cost for the patient and for the healthcare system. So this is the right way to make possible the introduction of new tests in clinical laboratories if they really decrease the cost for the healthcare system and improve the outcome for the patient. We are moving now to the topic of integrated diagnostics. Laboratory medicine is very important in optimizing pathway flow. And this means that we have to make possible an expansion of our traditional roles and the ability to communicate the contribution of laboratory services to other stakeholders, including patient and physician. And therefore, integrated diagnostics mean the possibility to create a joint diagnostic report for all subdisciplines. No more one report for clinical chemistry, another one for hematology, but even putting together the data of laboratory medicine and, if possible, anatomic pathology and the future radiology. What means clinical therapeutic pathways? In this slide, you can see some very common integrated diagnostics in acute myocardial infarction, particularly in stroke, venous thromboembolism, cancer, infectious disease, Alzheimer, neurodegenerative disease, kidney disease, integrated diagnostic in COVID-19. So, this is a paper we published some years ago. Laboratory medicine should be integrated with pathology and radiology. And in this way, we have an integrated report which is very useful for the physician, but also for the patient. But there is another further type of diagnostic integration, because there is an increasing use of wearable health services such as Apple Watch, Fitbit, which make possible for people to take greater ownership of their health. At this point, there is the need to create a bridge to the formal healthcare system and to integrate all diagnostic and laboratory information. You can see at the bottom of the figure a paper dealing with at-home diagnostics and diagnostic excellence. And this is a new deal we have to take into account. So, in this revised version of integrated diagnostic, you can see that not only laboratory medicine putting together clinical biochemistry, immunology, hematology, coagulation, virology, microbiology, with pathology and radiology, but even the integration of point-of-care wearable devices, results, and information. And this was really very much appreciated during the COVID-19 pandemic, in which clinical chemistry results, immunoassay results, microbiology, virology results, hematology, coagulation, with radiology and pathology made possible the right diagnosis and the right treatment of the patient. So this is a paradigm of future integration. And you can see what happened in the pandemic. The molecular, but thereafter the antigen testing for the diagnosis, even symptomatic, asymptomatic, and pre-symptomatic individual, was very, and still is very important for the prognosis, the measurement of antibodies and morphological lesions. To guide therapy, still neutralizing antibodies, very important. For monitoring many clinical chemistry, coagulation, hematology tests, and for the surveillance, once again, serological tests and neutralizing antibodies measurement are very important. So, this is my message. We have to move from the traditional clinical lab 1.0 to a new clinical laboratory 2.0. And you can see that means to improve the impact of diagnostic testing and interpretation, improve the value for diagnosis, prognosis, and guide to therapy of laboratory testing, and assess the outcomes of laboratory and diagnostic testing. And we have to look and to assure future to the young generation of laboratory medicine professionals. And this is why I published this manifesto for the future of laboratory medicine professional 2 years ago. There are 10 points to be taken into consideration. One is to combine the data of all laboratory subspecialty and diagnostic imaging to facilitate more effective teamwork, to be actively involved in interdisciplinary teams, to implement the laboratory medicine stewardship, and to promote the value of the profession. I will conclude my talk with some take-home messages. Sustainability in healthcare represents a major challenge for clinical laboratories, no doubt about this. And clinical labs may contribute to a sustainable healthcare system, ensuring that the resources can be used in an efficient way from ecological, social, and economical perspective. But major contribution is represented by improving clinical effectiveness, the so-called value-based laboratory medicine. And therefore, quality in laboratory medicine should be evaluated using process and outcome measures. We have to still measure the analytical quality. We have to measure the quality in the total testing process, but we have to introduce outcome measurement to provide a better evaluation of the true value of laboratory services. Care, therefore, must be integrated and coordinated across patient journey. The model of integration should be further coordinated with radiology to provide joint integrated diagnostic reports. Clinical diagnostic and therapeutic pathways are fundamental to assure quality and safety to the patient journey. And finally, the future of laboratory professionals require more and better concern. Thank you for your attention. I hope that this talk should be useful for you. And finally, I wish you that the Brazil soccer team should win the championship, even because Italy is not in the game. But really, I wish you a successful match.
Thank you very much, Dr. Mario Plebani. It was really an amazing lecture, great lecture for all of us. I'm still think about lots of insights that you brought, and lots of people of the audience they have written me, and we have, if you have time more like for 5 minutes, some good questions that I think if you could address for us. Um, Basically, they liked a lot of the concept of measured outcomes, especially in the value-based healthcare environment. In the case of Brazil and some areas of Latin America, we have some closed health systems, and the role of the laboratory has been very important, especially in the role of prevention. And but at the same time, they have some challenge in how to measure. And you brought lots of good insights that we can use. And then we want to hear from you if you want to start from some measurement of the value of the lab, where you think that we could start seeing the first measures that we could work, especially to affect not only the health system, but also the patient and the laboratory itself.
May I say that the question is, of course, wide, but we have to start moving to the measurement of the quality indicator in the total testing process, including the appropriateness of requests and how well the laboratory results are acknowledged by the clinician and the patient, and to introduce some outcome measures. For instance, how many patients should need to have a recollection of blood or other biological samples for mistakes in clinical laboratory. This is very important. But the other is to unify the measurement of the efficiency, that is the cost of laboratory test, with the improvement of some clinical outcome, and the true paradigm is cardiac troponin. When we introduced cardiac troponin many years ago, some colleagues said, and the same was for natriuretic peptide, are very costly, much more than CK&B, but they save life. They save life. So the cost is much lower if you take into consideration the patient journey. And the other example is what I said for angiogenetic tests, in which they reduce the cost for the admission in hospital of preeclamptic women. So this is very important. And the take-home message is we have to stay near to the colleagues that I mean are the physician, but also the other diagnostic professionals, including radiologists, anatomic professionals, because we have to create the opportunity for integrated diagnostics.
Thank you, Dr. Plebani. And the second question is related to this very interesting proposal of integration. That's one of the persons of the audience mentioned that it could help us to have better clinical decision making, and how we think to, especially they challenge us, the industry, especially Roche, how can Roche help this integration? And do you have any perspective to share with us?
I believe that Roche should help us, first of all, to continuously make possible the development of innovation, and to create the opportunity to organize this type of webinars, seminars, and conferences, including the participants of other diagnostic professionals, I mean anatomic pathologists, microbiologists, virologists, and, if possible, radiologists. So, first of all, I implore Roche Diagnostics to maintain the quality of the services, not only the methods, but also the instrumentation, but the connection of this type of results with other type of diagnostic professional, and organize meetings and seminars with these stakeholders.
No, it's really nice answer, and of course, great insight for us. I think for the next edition of this event, I'm already thinking about to invite you, and we have some interesting pathologists in Brazil. We have radiologists. We have some. Brazil has a great architecture of a healthcare system. We have the public healthcare system, that's the universal healthcare system, the SUS, but we have also one part that's the supplementary part, that we have private health systems, private hospitals, private labs, and I think that we can have this great discussion. The last question that they mentioned for us is
let me
okay.
Let me add another point. Roche should support the implementation of better laboratory information system, which may assure the connectivity and integration of diagnostic information. This should be nice.
Excellent, Dr. Mari.
Sorry for interrupting you.
No, you were like the question is related to this, so you're already advancing
Okay.
the answer. The question is how we are in the way in the words in for the laboratory 2.0 for this digital lab. How you see in your perspective in this way. So it's already what you have been started talking. Thank you.
We are working to, in some way, stimulate the development of better laboratory information system, which should be able not only to manage the analytical results and the workflow, but to integrate the information with the clinical data for the better interpretation of the data, for epidemiological features, and in the way to make possible the integration with other diagnostic professionals, including radiology in the future. So I believe that Roche should stimulate and support this type of development. For instance, I like to ask Roche, not Roche, but so information technology, to make possible that my Apple Watch should be linked to other laboratory testing information in the future.
No, that's nice, and I think that we are globally. I was last week in Switzerland in this direction, and the last I think just to not they mentioned about the last question here is how you see the AI, the artificial intelligence, working on these algorithms, not only with the laboratory tests, the results, but also with pathology, radiologists, how you see the work of the protocol development, because it will be also a challenge when you go to a hospital, you see all a good team working together to be like collaboration based, team based work. How you see it to be like a disease management or line of treatment? How you see this surging inside the healthcare system?
Thank you, thank you. There is an increasing interest in artificial intelligence, machine learning system, of course, and I'm totally agree with this, but from my perspective, this is a topic of the mathematics, the philosophers, maybe engineers, that should provide us really good algorithms and systems. But from my perspective, from laboratory perspective, the lesson is we have to assure the quality of the data we are introducing in the machine learning system. Otherwise, if we introduce poor quality data, there is a mantra that says garbage in, garbage out. So it's very important that we maintain our focus on the assurance of the quality of laboratory data.
Oh, thank you very much, Dr. Ben. It's a great insight, and I fully agree with you. So garbage in, garbage out. You are totally right. So I think that we are finalizing here this great lecture that you provided to us. So we are very it was an honor for us, pleasure to have you with us in Latin America, finalizing this year. And we'd like to hear from you the last words to finalize. And like to thank you very much for your time. I know how busy you are with lots of activities. I know that it's already 7 o'clock in Italy, and you were very kind to be with us. So thanks so much, and I leave you for the last words for us for all the audience, the Brazilian people that are really happy with you here.
Thank you, Vitor. First of all, I was delighted to be invited, and now I'm delighted to stay with you. I love Brazil, and I love Brazil, the Brazil people, and I hope really to be able to visit you in the future. And my last word is this: the next talk you should invite me is about integration or the importance for the future of decentralized laboratory testing, because not only point of care, but laboratory testing at home and in other clinical settings should be very useful in the future. So I really hope we can cooperate also in the future, and I'm available to accept your invitation when possible.
No,
and my
thank you
last
very
word
much.
is thank you so much, because it was very challenging to have this discussion with you and colleagues in Brazil.
No, thank you very much. Grazie mille. We have a huge Italian community in Brazil, and we would like to thank you very much. Have a nice evening now, and we will finalize our afternoon.
Thank
Thank
you.
you so much, Dr. Plebani. All the best.
Ciao Vitor. Ciao.
Ciao.
Saluti a chi
Grazie mille.
sai tu, a chi è vicino. Ciao.
Grazie mille. Ciao.
Buona serata.
Buonasera.